Hi guys, my name is Alex Beckman, and I'm here to give you a short presentation on human trafficking and how you can identify, help, and advocate for your patients as emergency department nurses. The first thing I want to do is define human trafficking. It is defined as a crime involving the compelled labor or commercial sex act of an individual. I want to note that this does not have to be through physical force. It can be through the use of fear, threats, fraud, or the use of drugs. It affects both women and men. Men are typically trafficked for labor, and women are typically trafficked for commercial sex. So, why should you, as emergency department nurses, care about this issue? The main reason is because it's so much more common than we think. According to the US State Department, there are 60,000 victims of human trafficking in the United States. 15,000 new victims are brought to the United States every year for this purpose. Importantly for you, 87% of these victims have access to a healthcare facility, and often the emergency department is the first place these victims come for medical care. If done right, it only takes a couple of minutes and a couple of questions to save somebody from modern day slavery. The first thing we need to do in the emergency department is recognize the victims. There are many physical signs like bruising and scarring and signs of delayed care. In terms of sexual exploitation, these can include vaginal trauma, a high number of sexual partners, a high number of pregnancies, and then subsequent abortions. The behaviors of these victims often vary, but they will be fearful, they may be unaware of the time or day, or hesitant to answer your questions. One telltale sign is that this person will be accompanied by a chaperone. The chaperone may fill out the medical history without consulting the patient and may lack crucial medical history about that patient. We can also look for tattered clothing or clothing that is inappropriate for the weather. Most importantly, if it feels odd, it probably is. Now that we know the signs, how do we act on them? I want to give you guys a toolkit on how to interact with the victims of human trafficking. This toolkit is based on a victim centered approach. It is all about the patient. It is all about what the patient wants and how we can facilitate that. One important aspect of this is to give the victim as much choice as we possibly can. This person has had all the choice stripped away from them. They are told when they will eat, when they will sleep, and who they will have sex with. We need to be different from their abusers and put them at the center of our care. Part of this is separating them from their chaperone. Some hospitals have the chaperone fill out a brightly colored piece of paperwork to alert the rest of the department to what is going on. It is also important to explain everything. This helps to avoid re traumatization of the victim. Touching the patient to provide medical care without explicitly telling them may cause them to feel that they are back in an abusive situation. It is also helpful to ask open-ended questions to help them express anything that they would like. We can also use reflective listening where we try to see from the victim's point of view. Now that you have some ideas of how to interact with the victims of human trafficking, it is important that you understand that you have a responsibility to these victims and to your profession. So, how do we use these skills to advocate for your patient? When we're talking about ethical responsibility, it is important to note that from the American Nurses Association Code of Ethics, human trafficking violates the dignity and worth that we give every person. Some of you may also be wondering about autonomy and its ethical practice, but we must understand that we are mandatory reporters, and sometimes we have to act against our patients' wishes. If this is the case, we need to communicate that with our patients and advocate them all the way through the process. In terms of legal practice, we are required to report signs of human trafficking to the proper authorities for anyone we suspect that is under the age of 18, over the age of 65, or an adult of any age who's developmentally disabled. Failure to do so results in the prosecution of a Class A violation, opens that nurse up to civil suits, but worst of all, continues the abuse of a child. When we talk about social justice, it is important to understand that, like many other social ills, most of the burden of human trafficking falls on women, people of color, the poor, and immigrants. Helping to identify the victims of human trafficking breaks down differences along racial and socioeconomic lines. Just to note a few statistics, black and brown women make up 65% of all women trafficked. 80% of all labor trafficking victims are Latin and Asian immigrants, most of which are undocumented men, and young African American girls make up more than half of all the juvenile prostitution arrests. We will all live in a more inclusive society when less of our population is subjected to abuse, and we can help end this as nurses. Before I talk to you about quality improvement, I need you all to understand your role in this problem and how you can improve the system from that vantage point. Your role is to listen and establish trust. It is to educate the patient about reasonable forms of help, whether that is a phone number or a pamphlet, and to ask about safety. It is unfortunately all too common for victims to have multiple meetings with healthcare providers where we failed to ask, are you safe and is anyone hurting you? Your role is not to pressure the victims for answers. Your role is not even to determine if it meets the legal definition of a crime. That is the job for the police. When cases are built against abusers, they're often built on incremental exposure of the abuser. These interactions are crucial for the patient, but when we see them, it often isn't life or death. In the majority of these cases, the victim will be back to a healthcare facility for help, and we will get another chance to help them. Being consistent in our message and establishing trust can give this person a way out of their situation. So, what are the effects of making these changes to the system? First, you make a change in how the victim sees medical care. Next, you set a standard for how your department and your hospital communicates with the victims. You can also play a role in how student nurses and new hires learn to communicate with these victims. A lot of victims have the mistrust of authority figures, medical care professionals included. The reality is that we're not going to improve the whole medical care system overnight, but you can be part of the quality improvement on how your department and hospital helps people trapped in this cycle. It is of shame and low self-esteem that keeps them from asking help. I hope you've all enjoyed this presentation. Please feel free to come and ask questions after.